Hello and welcome. Today we're diving into a topic that many of us experience but don't always talk about, menstrual clots. It's a super common concern, so we're going to break down what's totally normal and when you might want to pay a little closer attention.
So, you've probably noticed clots during your period and had that moment of, wait, is this okay? You're not alone in wondering that. Let's get right into it and get you some clear answers.
Okay, the first thing you need to know is that for most people, seeing some clots is a completely normal part of the deal. See, your period isn't just blood. It's this whole mix of blood, tissue from your uterine lining, and mucus. When your flow gets heavy, your body's natural anticoagulants sometimes can't keep up, and that's when this mixture forms those jelly-like clots. So let's start by figuring out what a normal baseline even looks like. Because once you know what's typical, it's much easier to spot when something's off. Here's a really simple checklist. Let's run through this. A typical, nothing to worry about clot is usually jelly-like in texture, and here's a key one, it's smaller than a coin. You'll probably only see them on your heaviest flow days. The color can be anything from bright to dark red, and super importantly, they shouldn't be showing up with any intense pain, dizziness, or a foul smell. Okay, so we've got the baseline for normal down, but what about the flip side? When does a clot stop being just a regular part of your cycle and start being a little red flag that maybe you should talk to a doctor? And that brings us to the most critical part of our chat today. Let's walk through the specific warning signs that could suggest that there's something more going on. Seeing it side by side like this makes the difference pretty obvious, right? If your clots are consistently larger than a coin, that's definitely a sign to watch. Same thing if they're popping up all through your period instead of just on the heavy days. And a foul smell or really intense pain, those are clear signals that it's time to get some medical advice. And it's not always just about the clots themselves. It's also about how you're feeling overall. If you're passing clots and you're also hit with extreme fatigue, weakness, dizziness, or you're feeling feverish, well, your body is trying to send you a message. These kinds of symptoms could point to heavy blood loss or another issue that needs checking out. So if you are experiencing abnormal clots, you're probably wondering what could be behind them. It is so important to remember this next part is not for self-diagnosis. Please don't go down that rabbit hole. This is just to help you have a better, more informed conversation with your doctor. A doctor might look into a few different things. It could be anything from a hormonal imbalance to conditions like uterine fibroids, endometriosis, or PCOS. Other things like blood clotting disorders or even an IUD can be a factor. An early miscarriage could also be a cause. Honestly, a professional diagnosis is the only way to know what's really going on. All right, let's switch gears. While you're waiting for that doctor's appointment, or even if you're just dealing with clotting that's normal but still pretty uncomfortable, there are a few simple things you can do at home to help manage everything. These are all super straightforward, actionable steps. A warm compress on your abdomen can work wonders for cramping. Staying hydrated is always a good move, and since heavy bleeding can sometimes lower your iron levels, try to focus on iron-rich foods. Vitamin C helps your body absorb that iron, and cutting back on things like caffeine and processed foods can help reduce inflammation overall. If you only take away one single thing today, let it be this. Nothing is more important than your health. If you have any concerns, any at all, about your menstrual cycle, whether it's the size, frequency, or pain that comes with clots, please just talk to a doctor. Ultimately, changes in your period are one of the main ways your body communicates with you. Paying attention isn't about creating worry, it's about being proactive and feeling empowered in your own health. So the question I want to leave you with is this. Your body is talking. Are you listening? Thanks so much for joining us.